What are the various indications for giving fluids by different routes? Generally, we use intravenous fluids in hospitalized animals that either cannot eat and drink or have a lot of ongoing losses with diarrhea or vomiting or third space losses into their abdomen, chest, or other places. So intravenous is probably the cleanest, most effective way to increase the hydration or intravascular volume status of an animal. Oral hydration is always the best because that's the most natural. Animals or people are not really made to have fluids go by any other route. We're made to eat our electrolytes and drink our water requirements. So if an animal can voluntarily take fluids through the mouth, then that's ideal. If we can place some type of feeding tube or other device into the GI tract and deliver fluids that way, that would be an alternative as well. Subcutaneous fluids are really indicated for the more stable patients that just have increased need for fluids either due to dehydration or ongoing losses like polyuria and excessive urinary losses, or perhaps even diarrhea where they're being treated as an outpatient, and that's something that the owners could do at home, or they've come into the clinic, they're dehydrated, they need fluids, but the owner can't hospitalize the patient for some reason. Then we might be able to buy time, so to speak, with subcutaneous fluids to see if they respond to our initial therapy for whatever underlying condition might have caused them to become dehydrated in the first place. Most commonly, animals with chronic kidney disease would be on long-term subcutaneous fluids, but for the treatment of hypovolemia or any degree of decreased perfusion, subcu fluids are inappropriate. Intraosseous fluids are really only indicated for patients that we are unable to get intravenous access in. So those might be neonates or animals with severe vascular collapse where we really can't get a peripheral catheter in to give intravenous fluids, but doing something like a cut down to a jugular vein would take a lot of time. So we may be able to very quickly place an intraosseous catheter or needle to deliver the resuscitation necessary, and then we can place the IV catheter once they're more stable.